Dr. Lynn Kozowicz is Assistant Professor of Medicine in the Division of General Internal Medicine, University of Connecticut Health Center, and also the Medical Director of the Clinical Skills Assessment Program and the Director of the Preliminaries of Clinical Medicine course Part 2 for the medical students. She has tackled the most difficult and important final step in this videotape, which is how all of this is integrated together. Dr. Kozowicz, welcome.
Thank you.
I wonder if you can comment for us on how you pick and choose from among the many maneuvers that the subspecialists will do in their examination that's more confined either by system or geographic area in the body, and come up with a meaningful, comprehensive examination rather than simply endlessly repeating all variants and elements.
Well, it's a difficult problem when you have lots of tools in your toolbox to figure out which ones you'll pull out for any individual situation. And when I approach the exam, I really have several objectives, and perhaps the most is to develop a rapport with a patient and a relationship, and to reassure them and make them feel that they're in good hands. And the physical exam and the contact and interaction there plays a big role. The other is pre-test probability. So based on my history and other data that I have thus far, I have sort of a differential and some things that I'm looking for. And when I approach the exam, I'm looking specifically to either support or dispute some of those diagnoses that I'm considering. And of course, I'm also looking for anything that might affect the management of the patient or their future health. So I'm trying to pick and choose based on the individual which of the parts of the exam might be most meaningful for that particular case.
And it's clear that you're trying to employ an economy of time as well, so that you're replicating high yield maneuvers and avoiding those with low yield. Is that accurate?
Oh, that's very accurate. If you added up together the complete exams of each of these parts, it would add up to a very lengthy, complete examination. And so I need to pick and choose based on which is likely to be helpful in one particular patient.
I am avid to share your skill. I've had the privilege of watching you do complete physical examination before, but I would ask if you would indulge this audience in two particulars that deviate from your routine. One is to only mention rather than perform rectal and genital examination in the interest of the privacy of this patient, but with the caveat that those are certainly part of your routine, as they are of any physician's comprehensive routine. And the other would be, forgive me, simply to pass on the thyroid exam simply because they have seen it. Can you abide by that?
Certainly.
Thank you so very much.
You.
I will look forward to seeing you on tape.
I'm looking forward to it. Thank you. Mr. Grant and I have just finished the medical interview, and I've taken the vital signs, and now we're going to proceed with the physical examination. Of course, I've already begun examining during the medical history when I noticed whether he walked in independently or whether he required assistance. I've noticed whether he's been in distress. I've noted his grooming, his affect, his recall, insight, things like that during the history. And I'll now begin the formal part of the examination. So, Mr. Grant, if you would, just sit right up here for me. And as he's walking over, I'm noticing how easily or how comfortably he's moving. And we've already completed the vital signs. And so, Mr. Grant, if you can just take a look here. And I'll be looking at his skin. I'm looking for any lesions. I'm looking for local things, but also things that might suggest a systemic disease. We'll look here as well, perhaps palmar erythema or telangiectasia, which might suggest underlying liver disorders. I'll look at his joints. I'm looking for findings of rheumatoid arthritis in the MCP joints, or perhaps some deviation, or Heberden's nodes, suggestive of osteoarthritis. And I'll just look at his nails. Perhaps I'll see splinter hemorrhages from endocarditis or pitting from psoriasis, for example. And we'll check his capillary refill. I've also noted that his skin is warm and dry. And we'll move on up. And of course, I'm taking a look at his skin very carefully in every region of the examination. Okay, Mr. Grant, I'm just going to take a look in your ears. And I would, of course, do the same on the other side. I'm just going to test your hearing. I want to know, can you hear my fingers rubbing there?
Yes.
Okay, now tell me when you hear it.
No.
Okay, the same thing. Do you hear it here?
Yeah.
All right, now tell me when you hear it.
No.
Okay. With the hearing normal, I won't proceed with other testing. I'm going to test his eyes. First thing I'll do is just have you look up. I'm looking at his conjunctiva and sclera, and they look good. Okay, now I'm just going to check your pupils. I have you look straight at me. I'm just making sure that the light from my light source here does not affect both pupils, as I'm looking for a reaction on this side. I'm looking for direct and then consensual reaction. And we'll do the same on the other side. I'm now just going to ask you to take a look at my finger as I move it straight in. And I'm looking for accommodation as well. Then do a fundoscopic exam. Would dim the lights and ask the patient look straight ahead. I'm going to just ask you to focus right there on that leaf there, okay? Try to keep your eyes focused. If I happen to put my head in front of you, try to see right through it. Keep your eyes straight on that spot. Now be coming in rather close. And of course, I'm looking, depending on the patient's history, I may be looking for papilledema, I may be looking for stigmata of endocarditis or HIV or diabetes, etc. And I'll do the same on the other side. Then I may look in his nose if he has complaints, for example, of allergic rhinitis, but also if he has asthma, and I want to see if he has nasal polyps. And I'm just going to take a look in your nose. And the same on the other side. I'm also going to take a look into his mouth. Ask you, open your mouth and just say ah for me.
Ah.
Good. And any tenderness as I tap here?
No.
Okay, and curl your tongue up and let me take a look underneath. Common spot for oral cancers will be under the tongue, so be sure to look there. And then if the patient is a drinker or smoker, I have other reason to worry about oral cancers. I'll palpate as well. Often the oral cancer can be palpated before it can be seen visually. Okay. Now I'm just going to ask you to touch your chin to your chest. That's it. And look up. And look straight. And then if I'm worried, I may do a full range of motion, but I've at least checked for suppleness. And now I am going to palpate his lymph nodes. Is there any tenderness here?
No.
I'm just going to check your glands here. All the way to the submental. And I'm just going to undo this a little bit. Just to get more of your neck as I check the supraclavicular nodes here. And infraclavicular if you feel compelled. And then I'm going to check under your armpits here. Same thing for swollen glands. I'm just going to ask you to relax your arm and let me. Well, I'm palpating in 4 areas here. Now this may be a little uncomfortable. I'm going to push up high. And I'll do the same on the other side. All right. I'm going to check your back. And again, I'm looking carefully at the skin. I'm just going to tap here, and you tell me if you feel. Are there any spots that are tender to you?
No.
No?
No.
And here?
No.
Or here?
No.
Okay. I'm going to take a listen to your lungs. I'm going to ask you to take a deep breath in and out. Again. Okay, and a little bit to your side here. Again, in and out. Again. I'm going to do the same thing on the front. Take a breath in and out. Again. And the last one. Okay. Everything sounds clear. If there were any areas of concern, I might proceed with fremitus or agathony. I am going to percuss, so I'm going to just tap on your back as I listen to your lung. And I might check for diaphragmatic excursion if I felt the need. And next, if I have a concern, I want to be particularly careful in a cardiac exam, I would listen sitting at the base here. Just breathe normally and listen to your heart. Sounds fine. I'm now going to ask you to lay back, if you would. So you got to move on back.
Okay.
All right, I'm going to proceed with the neck vein. I'm just going to take a look at the veins in your neck, sort of a dipstick into the heart, if you will. And that's perfectly normal. It's kind of a measure of either how full or how empty the blood is going into your heart, and yours is just fine. I'm now going to palpate the arteries in your neck. Perfect. And I'm now just going to listen to the flow. So I'm going to ask you to hold your breath. And breathe. And hold. Nice quiet heart. Okay, I'm going to take a listen. Breathe normally as I listen. And depending on my index of suspicion, I might do other maneuvers like have him lay in the left lateral decubitus or Valsalva isometrics, etc. Then in the male, I think it's worth to just do a quick breast exam of the tissue around the nipple area. Just going to palpate your breasts here. Any tenderness at all when you do that? The light palpation and then a deeper palpation. And that's normal. Okay? You comfortable like that?
Yeah.
I don't think I have a pillow for you.
That's
All right. I'm just going to lower your pants just a little bit so I can get a full view of the abdomen and pelvic area here. And again, I'm checking the skin, but I'm also looking for clues to other problems, perhaps a change in venous pattern suggestive of a portal hypertension, or in a patient with an acute abdomen, perhaps discoloration around the umbilicus or in the flanks suggestive of hemorrhagic pancreatitis. I could also look for asymmetric bulges, etc. I'll look for scars that might suggest other procedures that we may have missed in our discussion during the history as well. I'll then take a listen, and I'm listening for bowel sounds in a patient who's not having an abdominal complaint. That may be particularly useful. I may also listen for bruits, especially in someone, for instance, with hypertension or renal insufficiency. Okay. I'm then going to percuss lightly, and you let me know if this causes you any discomfort. There, and I would then take my measure and estimate his liver strain, which is normal. I'll press the spleen. Of course, we have heart and things here, so I won't try to come from above. Then I'm going to do a light palpation. Let me know if this bothers you at all anywhere. If there's any areas that are particularly sensitive. Okay, I'm going to push a little hard. It's sometimes a little uncomfortable when I push hard, but you let me know if it causes you any amount of discomfort here. Okay, now I'm going to check your liver and ask you to take a breath in and blow it out. And a deep breath in and exhale. Okay. We'll do the same thing over here. Breath in and blow it all out for me. Okay, deep breath in and exhale. Okay, I'm next going to check the groin area for any swollen glands and also check the pulses in that area.
Mm-hmm.
You take a lift at all?
No.
No? Okay. Nice strong pulses. Okay, I'm going to listen to the flow, same as we did in the neck over the groin area. Okay. I'm now going to check the legs. Let's see. I'm going to look at the skin. Again, I might have signs of vasculitis. I might look at signs for arterial insufficiency with loss of hair, shiny skin, thickened nails. Look for venous stasis changes. Even though the edema may be gone, it can give me a clue that he's had problems with chronic swelling if I find brownish discoloration here. So look for those things again. Look for bony deformities in the joints. And I'll be checking the pulses. I usually skip the popliteals unless I have a particular reason to check those. Good strong pulse here in the ankle. And I usually check the pulses individually. I find it kind of distracting when I do them together. I may feel one and interpret that as bilateral. And those are normal. And of course, I've examined his feet very carefully. Melanomas, notorious for hiding between the toes, lower extremities. Okay, I'm now going to check your hip motion. I usually like to do the range of motion and strength in low extremities while the patient is still supine. So I'm going to ask you to bend this knee for me. Does that cause you any discomfort at all?
No.
Notice I've checked the knee range of motion as well with this maneuver. And we'll check in the hip. It's good?
Mm-hmm.
All right, now I'm going to ask you to take this leg and just lift it up off the bed if you want. And now hold it up. Don't let me push it down. Okay, and push down. And again, the same on the other side. Now I'm going to ask you to straighten that knee out. Okay, and pull back. Good. And again, the same on the other side. Now I want you to point your toes up toward your head and hold them up. Don't let me pull it down. And now step on the gas. Good. And then can you hold that toe up for me? And push it down? Good. Okay. That would complete the supine exam. I'm going to ask you to sit for me. And again, if you could sit on the edge and kind of dangle your legs. Now complete the range of motion. I'm going to ask you to raise your arms up over your head. That's good. Now hold them out to your side and don't let me push them down. Keep them up. That's it. And push down. Good. Put them back. Yeah. Now push up and back. And the same thing on the other side. Excellent. Now I'm going to ask you to go like this and pull towards yourself and back. And now hold your wrists up like that and push down and pull back. Good. Now hold your fingers apart. Don't let me push them together. Excellent. I'm going to ask you to just hold my fingers, grasp them, don't let me pull them through. Same on this side. And hold your thumb and your pinky together. Pinky, if you would, thank you. And don't let me pull them through. Perfect. Same thing on this side. Good. Excellent. I'm going to ask you just to follow my finger. Okay? Keep your head straight toward me. That's it. Okay, I'm just going to touch you here with a Q-tip. Okay? You feel me touching you with it? All right, I want you to close your eyes and tell me when you feel me touching you.
No. No.
Is it the same both sides?
Yes. No. No.
Same?
Yes. No. No.
Same?
Yes.
Okay, open your eyes. Now I'm just going to touch you with this. It'll be a little bit different. Is that a little sharper?
Mm-hmm.
Okay. Feel me there?
Yes. Yes.
Same?
Yes. 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 Same. Yes. Yes. Same.
Quick study. Okay. All right. Now I'm just going to ask you to bite down for me. Okay. Excellent. Now I'm going to ask you to raise your eyebrows up. Crinkle your forehead. There you go. Okay. Close your eyes real tight. Don't let me open them. Okay. Now smile and frown. Okay. Now can you just stick your tongue against your cheek, against my finger, and push. Yeah. And now this side. Good. And turn your head this way, and this way, and shrug. Good. Perfect. Okay, I'm now going to proceed down a little bit, the same as we did before, just to check your sensation, okay? Can you feel me touching you there?
Yes.
All right, close your eyes for me.
No. No.
Same?
Yep. No. No.
Same?
Yes. Yep. 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 Going on.
Okay. And the same with the pinprick. Okay, now I'm going to check your sense of vibration. Ask you to give me a hand if you would. You feel that vibrating?
Yes.
Tell me when it stops.
No.
Okay. And the same thing here. You feel that vibrating?
Yes.
Tell me when it stops.
No.
Okay. The same thing on this side. Now I'm going to check your reflexes. Just going to ask you to kind of relax, like, ragdoll. Okay.